Uh, Councillor, okay, Larry and Reno, all in favor? Opposed, if any, that's carried. Any conflict of interest on the agenda as presented to you this afternoon? All right, there's none indicated. Then we'll go right to the update, Dr. Ahmed, COVID-19 update, and tell me that it's just an anomaly on those numbers today.
I truly hope that this is an anomaly. So let me just try to put my presentation up. So everybody can see my screen?
Yep.
Okay, perfect. All right, so as you know, the cases in the province is increasing at a rapid rate. Today, the province reported 4,700 cases, and this has been the highest that we have seen for such a long time, and clearly indicating that the 7-day rolling average from the province is increasing at a rapid rate and causing huge concerns with respect to the health system capacity, the hospital capacity, and ICU bed utilization in the province. And everyone is struggling at this time to deal with the influx of cases. This is the picture what we are seeing in Windsor-Essex. So we clearly we have seen some increase in recently in the last couple of weeks, but not to the same level that the province is experiencing right now. Today we have reported 93 cases, as Gary was referring to. We truly hope that this is an anomaly. We go back to tomorrow with less number of cases that we were typically seeing, anywhere between 30 to 40 cases. Most of the cases that we reported today, quite a large number of these cases are from close contacts or household contacts, and then the rest of the cases are from the community transmission. So we are seeing a significant community transmission, roughly around 1/3 of the cases coming in from the community. And with the variants of concern circulating, that poses a huge threat in our community, and the situation can change at any time with these variants. And just as a comparison, with the peak that from the province as well as locally, the provincial peak is obviously at a much steeper increase in the number of cases, whereas our cases are increasing, but still relatively stabilized compared to the province. Our week-over-week case, what we are seeing is also there's a slight increase from last time, and this is based on full completed week of cases that ends on Sunday. And our most recent completed week's rate is 76.5 cases per 100,000 population, which has increased from our last week when we reported 72 cases roughly with per 100,000 population per week. If we just look at the last 7 days and not focusing on the completed week, just in the last 7 days, our rate is 86.6 cases. So again, this is also an increase from what we are seeing locally. This figure looks at all the tests that are uniquely done in Windsor-Essex, and what we are seeing is the percent positivity in these testing is increasing, and currently we are sitting at, as of April 10th, at 5.3%. which is similar to where we were last week. If we compare our percent positivity with the rest of the province, some of the regions are seeing a huge increase in the percent positivity. We are almost close to number 7th with respect to the percent positivity, and also contributing to the percent positivity is the low number of testing that we are seeing in our region. This is the graph that looks at the school-aged children and the data on them. We've seen some increase in the number of cases, but it's stabilizing right now, and hoping with the April break and then with the next few weeks of online learning mandated by the province, should help this case rates in the school-aged children to go down as well. Overall, with respect to our cases, we are still at the third highest case rates in the province overall. This is not the most recent one. And a majority of these cases we have seen previously, and our cases are right now is better than the provincial average that we are seeing. Drilling it down to where these cases are, especially starting from April to present, the majority of the cases are coming from Windsor, but we're also seeing cases coming from Lakeshore, Kingsville, LaSalle, and all the other regions in the province, in the region as well. So relatively evenly distributed in the rest of the region, with some municipalities obviously are showing a slightly higher cases than the other, but those fluctuations happen over time. With respect to the age group, what we are seeing is we are seeing a decline in the cases in the senior population, thanks to a majority of the vaccination that has happened. And but we are seeing a shift in the cases in the younger population between the 0 to 19 and 20 to 29 in the last weeks. So overall, those are the two significant age brackets that we are seeing the cases mostly happening. The sources of acquisition continues to be the two largest contributor are the household contact and the community spread that we are seeing, roughly 32%, 30% each, which is which obviously high rates of community transmission leads to more risk to the community and further reinforces the importance of following public health measures. What we are also seeing is the variant of concern getting reported more and more every day. And as you can see in the last few weeks, our variants of concerns counts are increasing significantly. And the last few days, you have to note that it takes a couple of days before we get the result of those variant testing. So then the last few days numbers could change. But clearly what we are seeing is an increase in the variants of concerns activity in our community. This is the data that just reinforced the same point with our daily cases. There was a day when we have seen 70% of our cases coming from variants of concerns, but more or less we are somewhere around 40 to 50% of our cases are coming from variants of concern, and something that that could lead to an easy spread of the disease in the community. With respect to how these variants of concerns people are acquiring, a similar picture to our overall cases, household contact and community acquired, those are the two significant driver of the variants of concern. Household contact, obviously, it's very difficult, especially when the virus is much more transmissible, that they are acquiring it. But community acquired is definitely a concern, and that means that there are people out in the community either unaware of their diagnosis or aware of their diagnosis, but leading others to contract virus from them, which reinforces the importance of considering anyone you're meeting that are not part of your household could be a potential case, and everyone should follow their precautions when they're meeting with someone who is not a part of their household. COVID-19 hospitalization trend, and I briefly touched on that. The province is definitely seeing a very sharp increase in the COVID-19 hospitalization in the province, and that's reflected in the green line. In the blue line, this is where Windsor-Essex rates are, and we can see that our cases are fluctuating anywhere between 10 and 15 cases. With some days there's slightly more cases than the others, and we are not seeing the same trend as the province is seeing, but again, as I mentioned, with the variant of concern now contributing close to 30 to 40, and some days 50 to 60% of the cases, it is a significant threat in our community, and could lead to more hospitalization in the region. Similar picture in the ICU. While the ICU utilization in the province is increasing, our cases in the community, our cases in our region in ICU is relatively stable, with 3 to 4 cases that's been reported on an average, and something that we are monitoring very closely. With large number of deaths, close to 409, I believe. The trend is still the same. The most significant predictor is the age, where majority of the people who died were in the age of 80 years and older, followed by 70 to 79, and then 60 to 69. Our case fatality rate is slightly higher than the provincial average. So in the province, 1.9% case fatality rate, whereas in Windsor-Essex, it's 2.8%. And majority of that 2.8% is driven by the community, the people who are dying in the community, as opposed to the long-term care home. Our long-term care home case fatality rate is lower than the provincial average. When it comes to case doubling time, our case doubling time is higher than the Canadian doubling time as well as the provincial doubling time, and we stayed higher for some time. But now the doubling time is decreasing, which is concern. That means that the cases are increasing in our community. Looking at our median R effective rate, the median R effective rate, the most recent one is 1.17, and as you can see, there's an indication that it's increasing again. Last week it was better, but this week it has increased slightly. So quick update on the vaccine status, and at a total of 124,578 doses have been administered, and to 112,027 residents who have received at least one dose of the COVID-19 vaccine. This is a breakdown that we are seeing day by day, and as we can see, at our peak, we vaccinated close to 4,200 people in our region, and now very easily we are touching anywhere between 2,000 to 2,500 vaccines per day, and some days going all the way up to 3,000 as well. With respect to the cumulative doses that is administered, just a quick picture. And this is a breakdown of all the vaccine that has been given to everyone in Windsor-Essex, broken down by their age group. Overall, our coverage right now is 25.6%, whereas our just if we're looking at 60 plus population, our coverage is close to 75% of our population who are 60 years and older have received at least one dose. With the highest dose, vaccinated group is the 80 plus, followed by the 75 plus and 70 plus, and so on. We talked a lot about the hotspot areas, and this is what the picture looks like when it comes to the hotspots. So overall, our coverage is 25.6, as I reported. But when we are looking at the hotspot coverage, our coverage rate is not too bad. It's 21.5%, with some postal code areas identified have a coverage rate that is higher than the overall coverage rate. There are some areas that definitely requires more attention. The N9B and N9C, including N9A, which is the downtown core, and something that we are working with our partners to create more awareness and to offer more vaccination opportunity for them. With respect to the different types of vaccine that we have distributed so far, the majority of the vaccine that we have distributed in our region is Pfizer, followed by AstraZeneca and Moderna. Most of the AstraZeneca, or all of the AstraZeneca is given at just the first dose, whereas a small proportion of Pfizer and Moderna is given for the second doses as well, for the seniors who are in the long-term care home and retirement home who are eligible to receive the second dose. The rest of the population is all waiting for the interval, which is 4 months. So another way to look at it, a day-over-day average with the type of vaccine that's been distributed in the region. And as we can see, in days when we have reached the peak of 4,000, the majority of the vaccines administered were AstraZeneca through our pharmacy channel. And more recently, there's more effort with respect to our mass vaccination clinic and the targeted clinic that's been happening throughout the region. So in summary, the case rate in Windsor-Essex is again increasing week by week, and it's slightly higher for the most completed week, as we have seen. Acquisition sources is mainly distributed between the close contact and the community transmission. Our hospitalization and ICU admissions have stayed relatively low and stable in the region, but whereas the rest of the province has seen a huge increase in the hospitalization and ICU bed admission. Vaccine rollout is really picked up since the beginning of March when we received a lot of vaccine, and now we are at a steady state with at least 10,500 doses of Pfizer coming in every week. Our vaccination coverage rate is almost 25.6% so far. With respect to the monitoring indicators that we have, the most recent completed week, it's 76.5 cases, but just the last 7 days, we are at 86.6 cases. Our percent positivity continues to be high, which is 5.3%, and our most recent 7-day percent positivity is 6%. Our R effective is 1.17, indicating that the cases are increasing in our community. Thank you.
Well, thank you, Dr. Ahmed, for a very comprehensive report on that. Is there any questions, members of the board, that you want to pose to Dr. Ahmed at this time? Yes, Deputy Mayor McKetty.
Thank you, Chair. Just a question for Dr. Waji regarding those that are 80 and older group. There's some that are shut-ins that are living at home, and there was talk about the paramedics going to the homes, and I'm not sure who's overseeing that, who's responsible to make that happen. Calling the LHIN, they haven't heard any information. No one's given them any direction on how to reach those individuals. Do you know who's responsible? Would it be the hospital taking the lead, communicating with the LHINs? Because they need direction, and there are individuals living at home that have not received their vaccine yet.
So the individuals who are registered with LHIN and receiving home care, we're working on a strategy to start vaccinating them in the coming week. But just a senior who is homebound is not registered with anyone. I don't know if maybe Teresa may have more to add, but I don't think that they are prioritized in any way. We are hoping that with more of the primary care providers coming on board, they should be able to address all these individuals. Teresa?
Teresa?
So we are starting on Monday with our nurse practitioners. We're going to have 2 teams going out working on the adult recipients of chronic home care that are homebound and not able to get their vaccinations. The LHIN originally told us that they had about 100 people, but we know that it's probably closer to 300. 132 people are actually in the identified hotspot postal codes. So we will start with those people next week and move on and slowly get everyone completed. So if you have people that are receiving any type of home care through the LHIN, they will be reached and offered a vaccine in the coming. We're trying to get this done in the next couple of weeks. So it is starting, and it's basically because we've been given the go-ahead regarding the transport of individual syringes of the vaccine.
That's excellent. Thank you. That's good news to hear. Thank you.
All right. It was Larry, Reno, and then Ed.
Yeah, thank you through the chair to the doctor. The cases of young people, children, I don't know if I missed it or not. Are those cases on the rise also?
Thank you, through you, Mr. Chair. What we are seeing is, yes, there is an increase that is happening in the school-age children. The increase is not as different than what we are seeing in the community. So it is pretty much parallel to what we are seeing in the increase in the community. And majority of these cases that are acquiring in the school-age children are through their family, and it's not through the school system. We do have, we did declare, I believe 3 school outbreak now that are currently declared where there's an evidence of transmission, but the majority of the cases that are in the schools right now continues to be through an acquisition source that is their household contact and not necessarily the school.
Okay, thank you. One further question, if I may, through the chair.
Yep.
You say the number of vaccines available, what was the numbers that's coming in weekly?
So we typically get 10,500 doses of Pfizer every week, and we'll continue to receive it at least up until mid of May, the same allocation unless something changes. We also get Moderna, a small amount that we receive, roughly around 2,000 doses a week, that we are using it for the other priorities, such as the homebound individuals and all those people. So that's a limited supply of that we receive. And then we have received a large shipment of AstraZeneca in the past through our pharmacy channel. And some of our primary care providers are also receiving AstraZeneca, but those are very limited supply of those vaccine. Our workhorse vaccine continues to be Pfizer for the most part, with some allocations of Moderna in our region.
The only reason I'm asking that, doctor, because there's rumors flying out there right now where the supply is not going to be there. Okay, and I just want to make sure if I'm asked that question again that I can answer it properly, because there is rumors flying all over the place that there's not enough vaccines coming in. So thank you for that info.
All right, I've got Reno next, and then Ed.
Thank you. Just following up on Mayor Snively's question with respect to the actual numbers of vaccines, right by the chart, by the number of vaccinations, it's looking like we're doing anywhere from 15 to 20,000 a week, based on daily averages. Is that? But we're only getting 10.5. So is the rest of that the other two vaccines put together through the pharmacies and through the other providers?
That's exactly the case, and again, we have to collate all these numbers together to give you an exact count. But obviously, in the late March, we received close to 14,000 something doses of Pfizer in that timeline as well. So some of the rush that you may be seeing was from some of the leftover vaccine from that part, but typically, whatever vaccine that we are receiving, we are planning to distribute it as quickly as possible without holding any, with the exception of ensuring that there may be some potential 1 or 2 days delay. But the rest of the vaccine that are coming in, we are delivering it. AstraZeneca still, we don't have a good sight line on how much and when it's coming, so there may be more. But whatever you are seeing is a cumulative total of all the vaccine that are available in our region, including Pfizer, Moderna, and AstraZeneca.
So the AstraZeneca is not being, it's not being doled out similar to Pfizer with any expectations. It's just when they get it, we may get a certain dump in the region, so to speak.
That is correct. Yes.
Okay. I also wanted to ask about, and so obviously there's been talk about people outside the region coming into the region for vaccines, and wondering if there was anything that we could do. I know that other health units, for example, if you go on Toronto, for example, and type in an address for Windsor, they redirect you to WetChu's website to sign up in Windsor. Is there anything that we can do to discourage that, or to encourage them, like divert them to their own health unit from when they sign up on any of our systems?
I don't think so. I think the province is very clear that they don't care where each of these individuals are coming from. It's a provincial supply of vaccine, so they just want it to be available for everyone. Some of the health unit, or most of the health unit who are on the provincial booking system, they can book anywhere they want. I don't think that it allows them for it always allows them to book the vaccine wherever they want. Some of the health unit that have their own booking system, they have, without coming out maybe more publicly, but maybe implicitly, they are not booking anyone who is outside of their region. Most of our vaccine that was given out to individuals who doesn't live here are generally the people from who received AstraZeneca, because our region, if you recall, was the pilot site to receive AstraZeneca and was the first to drop the age down to 60 plus. So most of the people who got the vaccine in our region basically came in here because our region was very different than the others. So right now, with majority of the health unit are giving out vaccine to 60 plus population. So we would see a decline in people just going to other region to get the vaccine. But the provincial direction is clear. They want us not to turn away anyone who's coming to our region.
Okay, and thank you for that. And with respect to the targeted postal codes, how long do you expect that would continue insofar as even as the age limits reduce and we start going down to 45, 40, 35, etc., would those targeted, does it look like those targeted areas or postal codes would remain in place all the way through until we go through the entire population?
That's a good question, and I don't have that answer at this time. So the provincial direction right now is to make it available for 50 plus at this time. They are doing some pilot in Toronto and Peel with the younger population and see how these pilot will roll out. Our plan is to continue to vaccinate as much as we have supply and as long as there is demand to cover the 50 plus population as best as possible. If we just focus on those areas, we will be putting other regions at a disadvantage when we are already seeing a good coverage in some of these postal codes. So we have to be careful about how we further reduce the age limit in those hotspot zone versus the rest of the region. So right now we are in the phase 2 priority and under the phase 2 hotspot, but there are a number of other workers who cannot work from home. They need to get the vaccine. So our focus is combined with the hotspot, combined with the congregate setting, combined with some of these workers that cannot work from home. We maximize our coverage and with the limited vaccine that is available, and we'll wait for further direction from the province when they tell us to move to reduce the age bracket further. And just last comment on that is if we reduce the age bracket, then we open ourselves for people who may come to our region just to get the vaccine because in their region they won't qualify.
And in terms of, you noted that there was the variance of concern has seen an increase. Is there any evidence or data showing if those variants are reacting differently to vaccinations, or if the vaccinations are covering those variants and protecting people against the variants as well? Or are we seeing any of the variants that are causing problems for even people who have been vaccinated?
Great question, but unfortunately we don't have the answer to my understanding. The data is analyzed at the provincial level because at the local level we won't be able to analyze the data just because of our low sample size. And it becomes a question only when you have a vaccinated person who then contract the disease. And then you'll have to pull that number. There's not a lot of people, at least in the province at this time, where we are questioning vaccine effectiveness. There are some other countries who are reporting that. So Public Health Ontario is analyzing all that information, and when the information comes in, I can definitely share with the board if it would be of interest in terms of the vaccine effectiveness in Ontario.
Great, thank you, Chair.
Ed?
Yeah, thanks, Gary. A lot of people in my ward, they know I sit on the health unit as a board member, and some of them, they ask questions like, I don't have the answer for it. And what I do, I usually write them down, kind of waiting for our meeting, kind of ask Dr. Ahmed. One of the thing, if maybe too short a question, one of them, if a couple or a person got the Pfizer, and then can he later on get Zeneca or some others, or it has to be the same injection, the same kind?
So right now, You will only get the second dose of the same vaccine. There is no recommendation to change the vaccine. If it changes in the future, it will. But right now, if you got Pfizer, you'll have to get Pfizer for the second dose.
So even if Pfizer is not available, you have to wait for it until it becomes ready.
That is correct. Let's just hope that we don't come into that situation where we don't have the vaccine. But yeah, they have to wait and get the same vaccine.
Dr. Ahmed, thank you. And my question actually goes to Teresa. Hopefully Teresa can help us with it. I have some people actually contacted me and they said to me that they have the first shot of Pfizer. It was husband and wife. They are in late 70, by the way. And the wife got an email from the hospital that she's booked for July, while the husband, he did not get anything. And the reason, like they were asking, they say the wife, she doesn't drive, the husband does drive. I'm just wondering, both of them have the first shot together, and seems like they're splitting them up. There must be a good reason. I don't have the answer for them, but I would appreciate any answer you can give me.
So our health unit hasn't booked second doses yet, but Windsor Regional Hospital has booked some second doses for those that received vaccinations at the Sportsplex. So if you're saying two people went together at the same day and they went to the Sportsplex or even the downtown Windsor Hall, they will likely be given the shot together again, but we are not booking second doses quite yet. We will do that shortly, but Windsor Regional did start booking second doses, but they've stopped that as well. So it might just be a timing thing, but they'll likely be accommodated.
Yeah, Teresa, I understand from them, they were booked at the same time for the first shot, and they had the first shot together, and they were told that it'll be 3-4 months from now before they get the second shot. Well, apparently the wife got the email from the Windsor Regional Hospital and they booked her already, but the husband is in limbo. So, you know, it's not critically important, but hopefully you have some answer that I can give those people.
Well, the answer would be that Windsor Regional Hospital will get to them. They've stopped booking second doses right now, but they'll get back to it, and the other spouse will probably be sent an email as well confirming their appointment.
Teresa, your staff, you and your staff doing an excellent job. I just want to thank you, not just on my behalf, but also on my behalf of my constituent of Ward 5. Thank you very much.
Thank you, Ed.
All right, and any further questions? The only question I have is when do we pivot as well in terms of where's the transition to those who are going to be receiving their second dose and continuing to ramp up? What's the game plan, or what time? So obviously, the object of extending the vaccination between doses was to get as much as we could in individuals' arms. But at what point do we now pivot to the point where the 16 weeks? Because they're saying that's, you don't want to go beyond that. So when are we going to start or maintaining the vaccines to start doing the next stage? Because I just heard Teresa saying they stopped booking in July, certainly at the clinic, but where's that time period where you have to start now really looking at, because there'll be a lot of questions of folks why we're not vaccinated, the numbers are slowing down in terms of the total. You follow what I'm saying?
Yes, so we do know that our second doses have to begin toward the end of June. And based on vaccine supply, we'll have to determine if we can also do first doses at that time. But we are working internally on the booking system for second doses, and that will be something that will come out shortly. Windsor Regional Hospital has other challenges because their site where they're at the Sportsplex in downtown they're they have to be finished there in August. So that's why they're trying to move ahead and get some of this work done. And they also started before we started. But we are working on an internal booking system. Well, our booking system where people will be given second doses, and we'll start booking those. But according to our records, that'll begin the end of June.
Okay, hopefully, but hopefully by that time, the shipments will increase, and we'll be able to continue the first dose with those who are remaining, and then doubling up on those who need it. Okay, any further questions on that? Then a motion to receive the presentation. Ed and Reno, all in favor? Opposed, if any, that's carried. Dr. Ahmed, on your presentation and that, is there any way that you could maybe send that off to board members, but also to the CAOs across our region?
We do, so I do the EPI summary for Friday, which has more information, and all of those are available on our website. And I think in our update, we do send our update to all the CAOs regularly that has the more concise information. But that is available on our website. But if it is the wish of the board, we can send.
Just those, because this one's quite comprehensive, which I think is, the other one is more a general one. But even if you were to send it to our CAOs, we'll make sure that we would get it, as well.
We'll send that, sure.
That'd be appreciated. Thank you. All right, members of the board, we've got the minutes of the regular board meeting of March 18th, as well as the special board meeting, board elections on April the 1st. If I could have a motion on those minutes, Joe and Larry, any on those minutes, any errors or omissions? I haven't heard none. Then I'll call the question. All in favor? Opposed, if any? The minutes are carried. Thank you. Just again, any business arising from the results of the minutes? Okay, I see none. Then we'll move to the consent agenda. You have information reports there. So if I could have a motion to receive the information. Ed and Fabio, all in favor? Opposed, if any, that is carried. New business, CEO, the quarterly report that'll be presented by our CEO, Teresa Meritet. I don't know where you found time to do this, but we appreciate it.
Well, this is the standard quarterly report that we provide. And toward the end of the report, you'll see that because we still are in a pandemic, that some of the existing challenges we had all last year continue. And basically, many of our staff remained redeployed to assist in the COVID response, both case and contact management, and now the vaccine rollout, and also dealing with outbreaks. So that's the only, challenge with the compliance report, is that we are not business as usual because we're still dealing with the effects of the pandemic.
Okay, any questions on the CEO's report? And if I could have a motion to receive the report as presented, Reno and Larry, all in favor? Opposed, that's carried. Thank you. All right. Other Board of Health, the different, okay, got two resolutions here. One to Doug Ford on the health and safety of the communities. And so what is the pleasure of the board? I think in terms of what they're asking, which I don't quite understand at the end, when it comes to the fire department and there are others, they have the right, they should be inspecting their businesses on at least an annual basis. I know that the town of Tecumseh, for example, they do that. Every business and establishment is inspected, as well as our inspectors. So they're asking in the last and further be resolved piece that ask that local municipalities be included in the communications from the local health units when they are making inspections, that the needs of fire and building safety may also be addressed. I really don't understand exactly what they're especially I think that's beyond the purview of the health unit. Reno?
Well, right. So I'm assuming that because there's federal jurisdiction there, that local building and fire inspections don't happen. But can either Teresa or Dr. Ahmed comment as to what currently is the process when the inspections happen for the house migrant housing?
Yes, so I can comment on that. Our health inspectors, anytime there are new arrivals for temporary foreign workers, we have an obligation to inspect the bunkhouses, the congregate settings. And in the past, as you know, most of nearly all of the bunkhouses are in Leamington and Kingsville area. So our public health inspectors would go out and they have requirements regarding the bunkhouses. As well, in addition, building have their own regulations, and as does fire. And so about a year ago, it's been a while, we did all get together with the municipalities, and we, because I think there was inconsistency on the timing of the inspections, and fire has certain regulations that are very different than the public health inspectors as our building codes. So if you do the inspection out of sequence, then we may go in, we as in our public health inspectors, and approve the setting or the congregate setting based on our regulations, but they may not meet building or fire. And so the operator will have heard, oh, you passed the public health inspection, but it's kind of a package deal. They also have to pass fire and building. And so we agreed to try to align our inspections with Kingsville and Leamington and do them at the same time. But it's not always, it doesn't always happen that way because of all of our schedules and our resources. So we go in, and if we inspect before fire or building, it's really, based on any further inspections or regulations they need to adhere to. And we give a report to the fire, to the other partners. So this, and I did share this at our executive board meeting earlier this month, is that this letter, when I received it, it concerned me because we have been working as a partnership with Kingsville and Leamington and doing these joint inspections when we can and communicating much better. So I didn't think there was an issue. And so this may have been something that occurred about a year ago, but we've met to rectify it. And I did speak to the CAO of Kingsville, and there did not seem to be any issues at this time.
So, but how is that any different than, for example, a restaurant inspection? There's fire, building, and health that needs to happen for a restaurant. Just as an example, they don't all come in at the same time. They'll come in when it makes sense for their individual ones. And if there's something wrong from a fire inspection perspective, let's say an entrance is being blocked, something that might be considered a fire exit, that doesn't necessarily hold back the health inspection from doing their inspection. So I don't, why is there such a priority on doing them together? I guess I'm not understanding what the high level of importance is. And quite frankly, it probably is more of a scheduling issue between fire, building, and WETU than it is a need to go out together.
Well,
I-
if I may, just on that, that's precisely the point, Reno, that I'm trying to grasp. And we have how many inspectors in health unit, and when we look at the thousands of businesses that require public health and fire in our own, that's a daunting task to say, okay, let's coordinate our calendars to do all those inspections all at a given time. And so that's why I find it very difficult and exactly what the real issue is, because our inspectors, say public works, public health, are looking at public health issues and fire going in to make sure they got the proper suppression if it's a restaurant, or making sure that they got the hydrants and making sure they got fire extinguishers and they have to be here and so forth. They're two separate things, and if it's a matter of saying, okay, signing off, if we've done an inspection at bunkhouse A, you send a report to the fire department. I don't know if you do that or not, but if you do, then that to me is you're doing your portion of it. Fire department then just adds or complements what's already there, but to bring in the Ministry of Agriculture and Food and a whole group of them, and I don't know how they they can say, okay, you guys have to coordinate your timings.
Well, especially when you're coordinating timings with 7 municipalities, 7 fire departments, 7 building departments,
Yeah.
right? It's not one and one. And so I'm prepared to make a motion to note and file this. So
Okay, I certainly would concur with that recommendation. So you're prepared to move that. Do I have support? Yes, Ed. All in favor? Opposed, if any, that's carried. Thank you. Next one is from Town of Essex. It's a letter to Doug Ford and Christine Elliott and Wajid and Teresa. Letter of support for small businesses. Well, I think it's kind of redundant now in terms of the lockdown provincially, but a lot of directions in that come from the province. And so Larry, I know it's coming from your municipality. If you can maybe speak on it.
Yeah, through the chair. This come up from a certain counselor on my council, and listen, I'm going to say it the way it is. We do support the small businesses. The lockdown, that's from the province. Okay, I really strongly believe there's nothing we can do about that. We are regulated by the province. The province puts the rules in, and we got to follow the rules. And that's what I say to small businesses. So I'll leave it at that, Gary. I mean, you know where I'm coming from, and you know
Yeah, no, I know, and because there's a real. I mean, every one of us. I mean, we represent our municipalities now here, and we all support our small business. We want to do everything that we can to support them.
Gary, just further that we don't want to see a small business close, and we're all in the same boat here. We want to see our small businesses succeed. We want to see them open, but unfortunately, with this virus and what's going on today, they just cannot open. I was glad to see the provinces finally come down to these bigger stores. Okay, for example, Costco and Walmart, and they're roping off the areas where like with clothing and toys and pharmaceutical and food is what you're going to buy now, which is in a fair playing field. So, and I think that's where this one, I'm not going to say one council, I think that's where the council was coming from. Okay, and I think the senior level government has solved this problem. So I'll leave it at that, Gary.
Okay, no, that's fine. If anything, the upper levels of government, I know the federal government has put a lot of money into support. I think the provincial government could do some as well. And I think in supporting those businesses when they do have to shut down. So With that, if I could have a motion just to receive the resolution. Reno and Tracy, all in favor? Oppose, if any, that's carried. All right, if I could have, okay, now the public business is coming to a conclusion. If I could have a motion that we move in the committee of the whole in accordance with section 239 of the Municipal Act. Ed and Larry, all in favor? Oppose, if any, that is carried. And well, Leanne, just give us some guidance in terms of when we are